Hi, good afternoon, everyone. Thank you, Dr. Divakant and AIOC for inviting me for this talk. I'll be talking about why, where, and how should one pursue a glaucoma fellowship. Let me introduce myself. I'm Dr. Amit Pandey. I did my glaucoma fellowship from Shankar Netralaya almost 5 years back, and currently I'm working as a clinical in charge in one of the biggest eye hospitals in Surat. So let us come to the first question of why glaucoma fellowship. Of course, you all are here to differentiate yourself from the herd in looking at fellowships. Why glaucoma per se? Because glaucoma is omnipresent. You will get glaucoma patients wherever you practice. It's one of the biggest causes of permanent blindness right now in the world and in our country especially. You have more than 11 million Indians with having a risk of developing glaucoma or already having glaucoma. And once a glaucoma patient, always a glaucoma patient. If you can retain your patient, that patient will be with you throughout their lifespan or your lifespan. So that needs to be considered. Every glaucoma patient, if you retain them, they will generate a lot of revenue for you over a period of time. Glaucoma training in PG has changed. In post-graduation, seldom we get glaucoma surgery. Especially surgical training in glaucoma is rare to find in postgraduate training programs. Unlike other specialties, you don't have a very steep learning curve for glaucoma, especially the surgical part of it. Glaucoma surgery is not very difficult. You also do not require very costly equipment, especially if you are practicing surgical glaucoma. Just your cataract set, your microscope, and your skill is what is required. It's one of the most misdiagnosed and mistreated diseases in ophthalmology right now, and that is why patients are looking for specialists, and patients will be looking for specialists in the future. Institutes will be looking for specialists because they don't want those patients who are mistreated to turn into lawsuits. And there's a huge deficit right now of trained specialists in glaucoma, especially in Tier 2 and Tier 3 cities. I practice in Surat, and when I joined, we had only 2 glaucoma specialists, that too part-time, coming from other cities. Right now, we are only 5 in a population of 50 lakh. Where to do glaucoma fellowship? These are the career openings that are there in a few websites. They're all requiring people from reputed institutes. Some of them mention also the institutes that they want their fellowships from. These are the institutes that are giving a long-term glaucoma fellowship right now in our country. There would be more. These are the ones that I could find who had long-term glaucoma fellowships in their portfolio. I would suggest to try for institutes which comes to your mind when you look out for good premium institutes, be it PGI Chandigarh, AIMS, Shankar Netralaya, Narayan Netralaya, Arvind Eye Institute, L.V. Prasad. Try to get into these institutes first. If not, then try to look out for others. There's a website of AIOS which lists all the fellowship programs that are available. It's incomplete right now, but they are updating it quite frequently. How to get into glaucoma fellowship? Most institutes, they have their entrance exams and then followed by interviews. Admissions are usually taken 6 monthly, and you should check for important dates in on their websites. Keep your CVs updated. You already had a beautiful session before this on how to do that. And keep your knowledge updated, like was discussed just a while back. What should you look for in a glaucoma fellowship? Minimum duration of at least a year or more is required to learn basic glaucoma and glaucoma surgeries. You should concentrate not only on surgeries, you should concentrate more on diagnosis and the management protocols. Which patients to manage medically and when to operate is going to save your patients as well as yourself. Post-operative management is critical in glaucoma more than the surgery itself. It's the post-operative management that you need to learn during your fellowship. Surgical training, like I already mentioned, it doesn't have a steep learning curve, and if you're a good cataract surgeon, you can easily transition to a glaucoma surgery. And hence the glaucoma fellowship should be interlaced with a good phaco training. That's going to be your bread and butter in the future. You cannot survive on pure glaucoma practice. Nobody does. Institutes, try to look for institutes with a dedicated community ophthalmology wing. Of course, that is where you get your surgical training. And try to look for institutes with a post-graduation program, because you don't want to end up doing all the clerical work, and you can also learn from your juniors and learn from their mistakes, and probably help in them during their mistakes. Like was already discussed, research should be a part of your fellowship, and this is the best time to publish and learn how to publish at least. Like I mentioned, you should look out for premium institutes. It looks good on your CV. You get to work with stalwarts in glaucoma. You develop a good PR. You be a part of a large alumni. You learn good work ethics. That's very, very important for long term. And you get to work with state-of-the-art instrumentation. Also, your fellowship should include a patch probably at the end of your training program, where you get to manage independent OPD or manage a peripheral center. That gives you an extra confidence for the future. And of course, you should look for a healthy stipend. Most of us would be in their late 20s or early 30s when they pursue fellowship, and a healthy stipend would help during that period. Thank you. Any questions?
It was a very nice presentation about glaucoma. Would you like to tell, since glaucoma surgery and management doesn't really require a steep and doesn't really have a steep curve, so going for a full-term fellowship or a glaucoma, or do you think people can do short fellowships, observations or?
I've seen many places where there are 1 month, 3-month glaucoma fellowships also. But like I told in my presentation, it's the protocols that needs to be imbibed in the fellow for them to start practicing glaucoma. And how to manage post-operatively, that's very important, and that will take time. You cannot just be in the OPD for a month and then learn all the nitbits of it. It has to be imbibed in you day in and day out over a period of at least 6 months to 8 months. You need to spend with people who are seeing 40, 50 glaucoma patients every month, every day, to learn all the nitty-gritties of those important treatment plans, and which patients to treat, when and when to operate, all those things. Plus surgery, it's not a very steep learning curve like retina, but yeah, it needs to be there, and no institute would be giving surgical training for their short-term fellowships, especially 1 month or a 3-month fellowship. No institute would be giving them hands-on surgery. Of course, you'll get to see surgeries, but that's not enough.
Yeah, and just one more thing I wanted to add to this was, say if you do a full fellowship in glaucoma, then how about, does that fellowship also make you confident dealing with the complex glaucoma cases, like managing complex pediatric glaucomas, or do you still require some kind of observership later on to manage them well?
Pediatric glaucoma is one aspect, yeah, which requires a little more, but at least you'll get to diagnose pediatric glaucoma, and probably you can send those patients to the big institutes. You can refer those patients to a higher center if your level is not that big. But yeah, you get to see complicated glaucomas in big institutes every day, and that is where these institutes it matters, and the surgical techniques will not differ too much in even managing a glaucoma, say a neurovascular glaucoma or a primary open angle glaucoma. The surgical techniques would remain almost the same, so it's not going to hamper in any way. Pediatric glaucoma, yes, the things are a little different, but most of the cases, 99% of your cases, if you go through a long-term fellowship, you'll be able to manage.
Thank you.